HYGIENE, health and hygiene management, hazards and control measures. Physical hazards. Health hazard. Noise hazards, noise-induced hearing loss, NHL. Tinnitus, ear ringing, roaring or buzzing, hearing impairment, hypertension, annoyance, sleep disorders. Noise control measures. Identify construction and commissioning activities that generate impulsive noise in the affected area. Place warning signs at the access to these areas. Pre-start talks within these areas to review the activity and discuss risk controls. Provide training for all affected work crews to understand how to properly use HPDs. Double hearing protection at or above 95 dB, to be worn, or single hearing protection where the HPD is designed to protect from extreme industrial noise and have high attenuation rating. Identify noisy areas at or above 85 dB, place hazard and PPE requirement signs, permanent use of hearing protection at or above 85 dB, Whole body vibration, WBV, hazards, lower back pain, damage to vertebrae and discs, ligaments loosened from shaking, motion sickness, bone damage, varicose veins, and heart conditions, variation in blood pressure from vibration, stomach and digestive conditions, respiratory, endocrine and metabolic changes. Impairment of vision, balance or both, reproductive organ damage. Whole body vibration, WBV, control measures, periodic equipment inspection and maintenance, if necessary, to keep vibrations low, daily equipment inspection to detect oil leaks causing increased vibration, awareness training to be incorporated in HSE induction, protective workers to provide them by gloves resistance to vibration and urge them to wear at work. Hand-arm vibration, HAV, hazards. White finger, also known as dead finger, damage to hands causing whiteness and pain in the fingers. Carpal tunnel syndrome, and other symptoms similar to occupational overuse syndrome, sensory nerve damage, muscle and joint damage in the hands and arms, for example, tennis elbow. Hand-arm vibration, HAV, control measures, monthly tool inspection and maintenance, if necessary, to keep vibrations low, awareness training to be incorporated in HSE induction, protective workers to provide them by gloves resistance to vibration and urge them to wear at work. Heat-related illnesses hazards, dehydration, skin rush, dizziness, fainting, rapid pulse, cramps, heat exhaustion. Heat stroke. Heat-related illnesses control measures, no water no work policy and water canteen part of the PPE, weather monitoring and heat index communication system, for example, SMS and flags, long sleeves, and long trousers policy, dehydration self-check reference posters, heat stress prevention training. Ionizing radiation hazards. Immediate health effects from high doses of radiation in short time not likely in the construction industry, therefore. Disregarded, delayed health effects of exposure to low doses of radiation, risk of developing cancer later in life and of passing on damaged genetic material to offspring. Cancers observed in populations exposed to low levels of radiation include leukemia, thyroid, breast, lung, and bone. Ionizing radiation control measures, establish exclusion zones with radiation warning signs, where possible and practical shield radiation source, for example, gamma source with lead or concrete, authorized third-party NDT subcontractor. Radiography awareness training to be included in the craft training, radiation source to be double locked in. Yellow metal containers. During transportation, containers to be fixed to the vehicle and minimum safety distance between cabin and source to be maintained as per legal requirements. Radiation hazard signs to be placed on vehicle. Radiation source stored at site to be double-locked in a separate unoccupied building. Radiation hazard signs to be placed on building and/or non-ionizing. Radiation hazards, arc eye, sunburns, skin cancer, cataracts, clouding of the lens, corneal injuries, involving the outer membrane of the eye. Non-ionizing radiation control measures, dark eye protection rated for the level of non-ionizing radiation, welding shields, sunglasses etc., long sleeve and long trousers clothing, face protection, awareness training in HSE induction and craft training. Construction dusts hazards. Eye irritation, lung cancer, silicosis, chronic obstructive pulmonary disorder, asthma. Construction dusts control measures, dust control, water sprinkling, for unpaved construction roads to suppress airborne dust, use of local exhaust ventilation, LEV, where cutting and woodworking is required in poorly ventilated areas and rooms, eye protection suitable for the job, use of respiratory protection equipment, RPE, suitable for the job, awareness. Training for all and craft training for workers affected by dust generated from their task. Chemical hazards. Epoxy resin hazards, irritant contact dermatitis. Allergic contact dermatitis, eye, nose, and throat irritation, asthma, poisoning, from accidental ingestion. Epoxy resin control measures, use of PPE as stated in the SDS, for example, rubber and chemical-resistant gloves, RPE, long sleeves, and trousers, eye protection, hazard communication and chemical handling training for those using chemicals, prohibition of food and beverage intake in work areas, SDS available with the product at the work location. Paints hazards, solvent-based paint, respiratory difficulty and coughing, rapid heartbeat, headache and dizziness, skin irritation and blistering. Irritated or watering eyes and sinuses, poisoning, from accidental ingestion, water-based paint, even though less harmful, water-based paints contain organic solvents and many additives, such as biocides, surfactants, pigments, binders, amines, and monomers. The chemical complexity may introduce potential health hazards such as irritative and allergic disorders. Paints control measures, use of PPE as stated in the SDS, for example, rubber and chemical-resistant gloves, RPE, long sleeves, and trousers, eye protection, hazard communication and chemical handling training for those using chemicals, prohibition of food and beverage intake in work areas. SDS available with the product at the work location. Lubricants hazards, skin irritation, and rash, and burning, dermatitis, lung irritation, coughing, shortness of breath, asthma, poisoning, from accidental ingestion, acne, hypersensitivity pneumonitis, irritation of the upper respiratory tract. Fuels hazards, CNS effects including irritability, restlessness, ataxia, drowsiness, convulsions, irritating to eyes and skin, pneumonitis, dermatitis, poisoning, from accidental ingestion. Biological hazards. Food and water contamination hazards, microorganisms, food poisoning, diarrhea, hepatitis A, dysentery, cholera. Food and water contamination control measures, water hygiene drinking water control program, daily fresh chilled drinking water with date label on the igloo and water dispenser cleaning and sanitation schedule, water filter maintenance and change schedule, drinking water delivery from licensed service provider. Food hygiene: raw and cooked foods to be stored in suitable storage rooms and compartments, for example, cold holding points, hot holding points, dry rooms, etc. All kitchen staff to possess a valid food handler certificate, daily kitchen and dining room cleaning and sanitizing,